So now we are going to visualize the investigation for a patient having birth asphyxia, prematurity, or low birth weight. For investigation, we start by investigating the disease. We start by investigating the birth asphyxia. Birth asphyxia, we investigate it by using supportive measures and confirmative measures. Supportive measures for birth asphyxia is just by using the pulse oximeter. And when the saturation is less than 90%, you can already say that this patient is going to have having birth asphyxia supportively. Now, to confirm birth asphyxia is by asking for the arterial blood gases. By asking for arterial blood gases, and with the arterial blood gases, you're going to have the partial pressure of oxygen is going to be less than 80 millimeters of mercury, and you have also acidosis with a pH of less than 7.2. It tells you that there is already birth asphyxia. So that's how we make a diagnosis of birth asphyxia. Now, the next one is the diagnosis of prematurity. Prematurity is a clinical diagnosis. Prematurity is a clinical diagnosis. Now, the problem with prematurity comes when a woman does not know her last menstrual period. It's a clinical diagnosis because we know prematurity from the gestational age and the last menstrual period. The problem comes if the woman does not know her last menstrual period. When the woman does not know her last menstrual period, the first method by which you can determine gestation is via the last menstrual period. But if you does not know, you can use other methods. The second method is clinical still. You can ask her from which time did the woman first had the fetal kicks, because the first time of fetal kicks is called quickening. And quickening corresponds to 16 weeks of gestation in the cases of multiparous, and it was 16 to 18 weeks of gestation in cases of multiparous, and 18 to 20 weeks of gestation in cases of nulliparous. One child pregnancy. Nulliparous is if you have no children, and multiparous if you have already more than one child. That is multiparous. So you can hear quickening by 16 to 18 weeks of gestation, while quickening is 18 to 20 weeks of gestation in nulliparous. So you can use quickening in order for you to know the last menstrual period. Still, you can use also the symphyofundal height, provided that you use the ANC card. In the ANC card of the woman, they place the symphyofundal height, and they place the symphyofundal height of that patient. And that symphyofundal height and the date at which the symphyofundal height was taken can help you also analyze that it is the gestational age of the child. So the symphyofundal height can help you know the gestational age of the child. The symphyofundal height, you have the symphyofundal height that she was taking, can help you know the symphyofundal, because when it is below the umbilicus, the gestational age is approximately equals to the symphyofundal height plus or minus 2 weeks of gestation. When it is above the umbilicus, the fundus is above the umbilicus, the gestational age is symphyofundal height plus or minus 4 weeks of gestation. So generally, those are the different elements. Now, you can also assess the last menstrual period and the gestational age from the obstetric ultrasound. The obstetric ultrasound can also tell you, and the most precise among the obstetric ultrasound is the first trimester obstetric ultrasound. Where you can measure the gestational sac diameter, you can measure the biparietal diameter, and you can measure the crown to rump length. You measure the crown to rump length. So those are the different parameters you can have from first trimester, and it is the most precise. So the gestational age there is approximately plus or minus 1 week of gestation. It's very precise. In second trimester, it is gestational age plus or minus 2 weeks of gestation, still using the biparameter diameter and the femoral length to estimate even the abdominal circumference. And the next one is gestational age plus or minus 3 weeks is in the case of third trimester. In second trimester is gestational age plus or minus 2 weeks of gestation, and third trimester is gestational age plus or minus 3 weeks of gestation in order to approximate your gestational age. So those are the different elements that you have to evaluate when you are speaking about the obstetric ultrasound. Now, Postnatal, there are elements that on your history that can help you to evaluate in postnatal, to evaluate for prematurity. Is it clear? For prematurity, you have to use the Ballard score. Is it clear? Use the Ballard score, and the Ballard score is made up of two major elements. You are going to have physical maturity, and we have neurological maturity. Is it clear? The physical maturity is made up of 5 elements like the posture, the ankle window. We are going to have the scarf length. We have the heel to ear and all those elements. Is it clear? The popliteal angle. So all those are the neurological maturity. We have also the physical maturity, that you have to see the appearance of the child in order to know if there is any abnormality. Is it clear? And the Ballard score can help you to approximate also the gestational age physically when the child is already born, provided the mother does not know her last menstrual period, or you don't have all those past history that is favorable to measure your last menstrual period. Is it clear? So that is a major element every time that you have a patient with premature. And every time you have a patient in prematurity, in the follow-up, you always follow up with the Fenton curves. Is it clear? In the Fenton curves, you follow up the weight of the child, you follow up the length of the child, you follow up the head circumference of the child. So those are the different elements that you have to follow up. Is it clear? Now, the next element that you have to visualize in this tutorial, you have to visualize now, so that is how you have to investigate for the prematurity. Is it clear? Now, the next element is to investigate for low birth weight. Low birth weight also investigation is clinical. There is no paraclinical investigation that you have to do for low birth weight. Low birth weight investigation is clinical, and you have to find if there is intrauterine growth restriction or not. And if it is intrauterine growth restriction, use the intrauterine growth curves to evaluate for that. You have to divide if it is symmetric or asymmetric intrauterine growth restriction, and you have to evaluate now for the etiologies. Is it clear? So those are the different elements that you have to evaluate. So for the etiologies, it depends now if it is birth asphyxia or prematurity. You have to evaluate each etiology. Now the next one is to evaluate for the complications of them. Is it clear? We say that the complication can be the complication related to hypoxia. Hypoxic ischemic encephalopathy, the diagnosis of hypoxic ischemic encephalopathy can only be visualized with the SANAT score. So you use it with the SANAT score and the Thomson score to evaluate for that. Is it clear? For cerebral palsy that can occur later on in life, you have the Denver score that you can use. It's a clinical diagnosis. And you have also CT scan that is going to show you neurodegenerative damages inside the brain. Is it clear? Also, the CT scan can also help you to know the hypoxic ischemic encephalopathy, because you're going to have signs of